Let me know when you're perfect. Good morning, everyone. Welcome to the EQIP Practice Transformation Grant Program Vendor Q&A session. Wow, that was a mouthful. Sorry about that. I'm Kim Dixon, the Practice Transformation Lead for the EQIP Practice Transformation Grant Program here at CRISP. Today's discussion will focus on the Practice Transformation Grant under the Medicare Episode Quality Improvement Program, or EQIP. We'll go over key details from the RFP and address any questions you may have. We're joined by representatives from HSCRC and CRISP representing our collaborative efforts in this initiative. So our agenda for today will start with a welcome and introduction to our team, and then next we'll provide an overview of the EQIP program and the Practice Transformation Grant. And then we'll discuss the key components of the RFP, including scope of work and vendor qualifications. We'll walk you through the proposal submission process and timeline, and then we'll address some frequently asked questions. Then finally, we'll open the floor to any other questions you may have. So let's begin by introducing, you already know me, so I'm going to pass it off to my colleague, Jessica.
Hi, good morning, everyone. I'm Jessica Heslop. I'm also with CRISP. I'm a director on the program admin team. And then I would like Crystal to also introduce herself. Hi, Crystal, I see you're on.
Hi, everyone. My name is Crystal Fort. I work on the program admin team with Jessica as well, and I work as a program analyst. Can you guys hear me?
Yes.
Okay, perfect. Nice to meet
And
you all.
finally on the line, I believe Krista from HSCRC is on. Sorry to put you on the spot, Krista, but if you want to introduce yourself real quickly.
Oh, sure, no problem. Hi, I'm Krista Spiker. I'm the Deputy Director for Payment Reform at the HSCRC and working closely with Jessica and Kim and Crystal on the Practice Transformation Grant Program. So thanks for joining today.
Thank you, everyone. Okay, Jessica, take it away.
Hi, yeah, so we are going to spend the first couple slides on EQIP background. We won't give a whole in-depth information about it. We do want to point out a couple of times in this presentation, we will reference our websites. We'll put them in the chat, but there is a plethora of information, including like a short 10-minute, even 45-minute overview of the program on our learning system. And there's also prior documentation, methodology, and policy things that are published as well. And then we also have a specific website for the Practice Transformation Grant, which includes, some, again, an overview and additional data. This will be where the recording is posted and stuff like that. But that being said, EQIP. So EQIP is the Episode Quality Improvement Program. It is a voluntary program. Historically, many Maryland physicians were excluded from some of the federal value-based care programs. So EQIP really was created and intended to create an opportunity for them. It is tied to the reduction of costs and does have quality metrics. So hopefully aligning incentives to reduce cost and improve quality. It did start, the first year was in calendar year 2022. So we are entering the fourth year in calendar 2025, and we will be utilizing a grouper methodology called PACES, the Patient-Centered Episodes of Care System. For prior years, we used a different grouper called Prometheus, but moving forward, we'll be using the PACES. It also is to note that we are now expanding over, I think, 10 different specialties with 65, or I think 66 different episodes. And we have a variety of participation across those episodes. Some of the episodes have been, were available and been participating in starting in the first calendar year, whereas some of them are brand new for this year. So we have a little bit of a mix because it is voluntary and it is up to the individuals who are choosing to participate in the program what episodes they actually would like to participate in. Next slide, please. And a little bit about like overall methodology, because ultimately that is what we're utilizing to determine success in the program. Every entity, and we use the word entity somewhat synonymous with practice, but it does not have to mean that. You could potentially have two different practices that are joining together to become an entity. But we use the word entity. We want to emphasize the word entity because that is the mechanism that people are participating and the mechanism of how they're evaluated in. So while each entity can choose a single episode or multiple episodes to participate in, ultimately they're giving one target price at the entity level that they're determining if there's been improvement in that target price in the current performance year. So for the first 4 years, including this upcoming calendar year, the baseline has been 2019. It is trended forward to be put into today's dollars or next year in 2025 dollars. And the other thing that is important is while there is the availability of drill down information based off of the setting of care, the target price and the program in general is agnostic to the setting of care. And certainly we believe that there is an opportunity for, when appropriately and clinically safe, to move episodes into a more cost-effective setting of care. After we evaluate the performance over their target price, essentially entities get a share of their savings. And we want to point out that really entities are trying to beat themselves. So state percentiles really only come into play when it's determined how much of the shared savings they get to keep. Before that, it really is, again, based off of their own historical data and whether they've seen improvement in the current performance year based off of that historical data. There's a lot more methodology there, a lot more detail. Again, we want to point out those websites for you to please reference, but in general, that's the very, very, very high level big picture of the program. I think I have one more slide. Oh, no, I don't. But I do want to, so I must have excluded it. I meant to include one more slide about quality metrics. So there are 3 quality metrics that are the same across all entities. They are BMI, medication reconciliation, and advanced care planning. And this is done independent of the type of specialty or the type of episodes that you're participating in. It is done across the board. And everything, both quality and payment, is evaluated based off of claims data. So there is no additional reporting requirements on participants. We get that strictly from the claims data. I'm going to put the websites in the chat right now and hand it over to Kim to give more information specifically about the grant opportunity.
Thank you, Jessica. Okay. Okay, so the Practice Transformation Grant Program is designed to support practices in their journey towards the improved care delivery. The grant provides resources such as advanced data analytics, IT solutions, care management tools, etc. The role of the vendor is critical in this process as they will be assisting the practices in meeting the program standards, optimizing their operations, and then ultimately helping the practices achieve better health outcomes. So let's kind of dive down into the actual key components of that. So the data analytics and the health IT support, this involves baseline analysis of claims data, EHR optimization, and then possibly also developing trigger code systems for better patient outcomes. A trigger code system basically refers to a set of predefined codes or rules within the health data system, such as the EHRs, that automatically identify certain clinical conditions or even events when specific criteria are met. The next component is the practice transformation services. So this includes conducting clinical documentation improvement audits, developing comprehensive care management plans, and then facilitating actual practice transformation initiatives. The required vendor qualifications are that vendors should have a proven expertise in data analytics, familiarity with episode-based payment models, and it's also very helpful to have experience working with specialty practices, as this is what we will be working with in this particular program. The vendors also must comply with all relevant laws and regulations. Excuse my voice. I'm sorry. I think I'm coming down with something, so I apologize for it not sounding okay. The eligibility, I wanted to overview the actual eligibility process for these entities. And so in order for an entity to participate in this grant, they must meet specific criteria. And those criteria include a committedness to the actual program year 4 or calendar year 2025 performance year. The entities from program year 1 through 3 that have not yet realized any shared savings, or at one point. Entities from program year 1 or 2 that experienced at least 1 year of dissavings. And then the new program year 3 practices, they're eligible for participation. The application evaluation will follow a structured process. Each applicant is going to be thoroughly assessed. The application evaluation is the initial review of all the applications, ensuring that everything was complete and that they actually meet the criteria. And then there's another process afterwards called the practice assessment, where a more in-depth review of the practice, they're examining their workflows, specific needs, their current state, etc., so we can get a better understanding of exactly what it is they're going to need as far as this grant is concerned. So the timeline for this, so the application period was July through August, September through October. That's when we're going to be doing the assessment phase, where each practice's current operations and needs are evaluated. And then in November, the grant selections will be communicated and selected entities will be notified of their participation. So let's turn our attention to the actual proposal submission process for the RFP. The proposal format is a single file that includes all your response materials and supporting documents. The deadline, obviously, for the RFP response is by 5 p.m. on October 4th. And please be sure to send all your proposals via email to equip@crisphealth.org. The evaluation criteria, all proposals will be assessed on completeness, the healthcare payment research capabilities, and the methodology to address the RFP questions. CRISP prefers an unbiased proposal, making things as neutral as possible in your point of view. Selected vendors will be contacted for in-person or webinar interviews, and CRISP may request additional information or refinements to the proposal. Contract awards are anticipated to be issued on or around November 8th. And then obviously, if there's any more information that you need or you have any other questions, you can absolutely reach out to us at the equip@crisphealth.org email for any clarifications. And we absolutely look forward to hearing from you all. This slide provides important resources for you to reference as you move forward with with your proposal process, and just giving you more generalized information on the actual programs that are involved here with EQIP. And now we're going to get into our frequently asked questions. So we received quite a few questions from a lot of you. So hopefully most of these will answer any questions that you may have, but we're happy to take any other questions afterwards. Let's start with, will you be investing in an analytic platform or hiring a consulting firm for this initiative? So CRISP and HSCRC are really right now looking for consultants in this initiative, but vendors may propose an analytic platform as part of their submission. Could you provide insight into the budget allocated for this initiative? So we've allocated about $3 million over a 2-year time span for the Practice Transformation Grant Program. This could be awarded across multiple vendors and will be determined based on the practice need. Responses should absolutely include scalability, either by practice or an hourly rate. How do you weight and prioritize the 5 tasks/objectives? all 5 tasks or objectives are important, and they will be prioritized based upon the practice entity need. You are not required to submit for all the objectives. How many claims data formats do you anticipate being processed? So EQIP data uses CCLF data. As part of the existing analytics suite, extracts at the episode level, physician level, and claim file levels are available to each entity. Are there any downstream systems or applications that need to receive data reporting? So there are no real reporting requirements for participants. All payment and quality data is determined through the CCLF files that are delivered. How many covered lives do you have? EQIP is really not based on covered lives, but rather based on episodes. In program year 2 or calendar year 2023, 75,000 plus episodes. But of note, each entity is required a minimum of 50 episodes for the year. What is the expected growth volume over the next 1 to 3 years? So the state expects EQIP to continue under the AHEAD model that is in progress of being developed. We anticipate a continued 5 to 10% growth in participation each year. How often should each data source be refreshed? Do any need near or real-time updates? So performance data will be published monthly, but it's important to note that only the completed episodes, including the claim runout, will be available. Baseline program year 4 data will be available in mid to late January. Should the proposal include just the implementation plan or also include ongoing support? In your proposal, include both. If you have both, include both. Sorry, there we go. Are you looking for solutions that will be entirely self-serve, or do you also need analytic and SME support or SME support? Provide all scenarios in your proposal. For baseline analysis, do you have access to the benchmarks you were referring to? Yes, state benchmarks data is available. The EHR optimization standardization of standardization of EHR templates. How many EHRs are in scope? There are a multitude of different EHRs, anywhere between, big EHRs like Epic all the way down to no-name brands like, say, Greenway and things of that nature. Or I won't say no-name brands, but very not as well known is what I'm trying to say. Are you looking for bidirectional feeds for the EMR, pushback for care alerts, etc.? This is not a requirement for submission. For EHR optimization, will you provide the logic, or would you be open to using proprietary logic? So we do not have any specific logic outside the deliverables mentioned in the RFP. Proprietary logic could be considered, so submit for that as well. Jessica, you want to take the rest?
Sure. Thanks, Kim. So as a vendor, is it necessary to apply for all available tasks? I think Kim touched on this beforehand, but it certainly is not a requirement. However, people are welcome to do so. And we do encourage vendors to really only apply to the specific tasks that they're equipped to complete. And we anticipate that we could potentially award multiple vendors this grant, because we can assume that there's different specialties or different resources that can be deployed for each of the tasks. How will the data flow between EQIP practices and our system be managed? So EQIP practices currently have access to their data, their claims data within CRISP. And we anticipate a data exchange or DUA would be set up with the vendor once that contract is finalized for those entities in which they are supporting. What is expected contract duration for this PGG program? So the PTG program is a 2-year program. We do anticipate, however, awarding the contract for a 1-year basis, but would like to continue into that 2nd year or even future years as we see how this grant develops, but it would be done in an annual type of cycle. What is the typical size of the practices that participate in the EQIP program? So you feel like for a lot of this, it varies. There's many. And because really this is a voluntary option for people to participate in whatever manner they see fit. So really wide range. The smallest practice is a single practitioner, and the largest is over 300. So we did intend, or really one of the main objectives of the grant was to provide, for the state to provide resources for those practices that may not have as many resources or part of, let's say, a larger infrastructure that can invest. So we believe that most of the applicants and those that awarded for the practice transformation grant will have 30 or less practitioners. But again, you might end up seeing that on a scale. What type of vendors are eligible to participate in the PTG program? So ultimately, we're open to any vendors that can really meet the expertise and the needs of the areas that we described. Primarily, we're hearing feedback and support needed in data analytics and their own health IT systems, and practice transformation and care management. And I think there was sort of other questions that reference this, but apologies. There's going to be a range of practices that need maybe at the elbow support versus those that really need in-depth support of how to really start something from fresh and ultimately lead to them being able to support, a care pathway independently. So a range of that, and we do want people to have the expertise to be able to, again, kind of have that scalability. And as mentioned, it is not a requirement for vendors to have an expertise in every single one of these tasks or areas. Please just submit proposals for those tasks that are most relevant to your expertise. And emphasis for experience or the ability to specifically meet the needs of specialty practices is something that will be considered. There are some primary care practices in this program, but most of them are specialty practices. Can vendors submit a joint proposal with a partner or partner with other organizations? Absolutely. We'd be happy to hear about that, and it may be a good strategy for those that are looking to apply to multiple tasks. But please ensure that in that submission, the clear roles and responsibilities are outlined so we can better understand that. What are the primary criteria used to evaluate the vendor proposals? We hit a little bit of these, but they mostly are going to be evaluated based off of the vendor's qualifications and experiences within, value-based care, episode-based model payments, and their ability and scalability to deliver these types of tools. Obviously, cost effectiveness is going to be one of those, and then alignment with EQIP objectives, which again are looking at success for those in cost reduction and improvement in their quality. Is there a minimum number of practices that vendors are expected to support? No, there is no minimum, but we do intend vendors to be able to demonstrate their capacity to work with multiple specialty ones. And again, it is a little bit depending on the scale of a proposal and the needs of the practice. For example, let's say we have 50 practices that submitted applications for EQIP. We could have 40 that say they need data analytics. We could have 15 that they need help with their EMR. So it could be a little bit of a variety based off the tasks. Kim explained that the evaluation for the applicants is kind of in parallel to the RFP submissions. So we certainly are happy to answer more questions as we've determined it, but really we're looking at what are the needs of the practices, and they will be varied, and they also will be differentiating in sort of the sizes for each of those tasks that are needed. What are the key success metrics for the vendors participating in the EQIP RFP program? So again, they're sort of evaluated on their ability to enhance the data analytics, care, IT optimization, and strengthen care management. Ultimately, we are looking at performance goals in the program. So that is that cost reduction and improvements in 3 key quality metrics. We also will, of course, look for feedback directly from the practices that have been working with them for the year, especially as we talk about extending contracts for additional years. How does the EQIP program support vendors in achieving program objectives? I think this is a great question. We certainly want, and a lot of the stakeholders on this call right now want to ensure that people have what they need, especially for that initial sort of startup collaboration, really help them understand the goals, the methodology of the program, give them access to data, regular updates on any type of enhancements or developments going on with it. So really being sort of that expertise when it comes to the program and policy side. Also want to provide an ear back if there are sort of recommendations at the larger level, reporting requests, things like that, and be that liaison between practices and the vendors as we're sort of ramping up, things like that. How should we submit our proposals and what documents are required? So again, we want you all to reference the RFP, but we do have a hard deadline of Friday, October 4th. And we do require that being sent via email to our equip@crisphealth.org. The necessities in your submission should include the technical proposal, a budget, your vendor qualifications, and references. Are vendors required to have previous experience working with CRISP or HRCRC? No, there's absolutely no requirements to have a prior relationship with either the CRISP or the state. We, again, are really looking at vendors to demonstrate their relevant experience with data health systems and the value-based care model, and also certainly open to working with people who we never have before. Will there be a follow-up after a QA session for any additional questions? So we are not going to have any additional webinar formalized Q&A, just giving the timeline of that. But please reach out to equip@crisphealth.org. We will be posting this Q&A on the Practice Transformation Grant website. And as questions come in to that inbox, we will update the FAQ that's posted on that website. So that should serve as the mechanism to have continued updates and questions answered. I think that's all of our formalized submitted questions through the inbox. I'll hand it back to Kim.
Oh, thank you. So we're going to open up the questions now to you all. If you have a question that hasn't already been answered, you can raise your hand icon on the computer screen, or you can submit your questions via the chat box. And Jessica, just so you know, I can't see any hand raises, so you'll have to let me know.
Yeah, I'm actually not seeing any hand raises or anything in the chat.
Oh, does that mean we answered everyone's questions? That would be amazing. Don't be shy.
I'll just make a comment because I think there was a little bit of a theme in some of the questions that were submitted based off of like consultation versus analytics and sort of things like related to what specific resources we're looking at. I want to emphasize that one of the main reasons for the state investing is that we certainly feel that some practices maybe are paralyzed with where to begin in the EQIP program or really in any value-based care program. Whereas we have some that maybe sort of know what to do or have implemented some things but cannot fully deploy based off of either resources, they don't want to invest in an analytics person or things like that. And we really are looking for someone that can provide expertise when it comes to data, but that additional consultation, because I think we can give someone all the data that they want and it's so wonderful, but if people don't know what to do with it or how to interpret it, how to prioritize, patients or things like that, that we believe is sort of the struggle of how to actually overcome the initial hump of implementing initiatives. So certainly something to consider. And there are so many wonderful things that we've already heard from people as far as opportunities that they have and leveraging technology, but one also, like I said, there is really a consultation service that we think practices will greatly need and ultimately will hopefully be able to eventually be pulled off of and be self-sufficient. That is really the goal. We're not hoping that they need an SME with them for years and years, but so just sort of food for thought as you guys are considering this. I see a question in the chat. It says, thank you for reviewing this. I want to see if the metrics will be reviewed throughout the year and or if the practice assessment will be done multiple times throughout the year. So we do have the data that is released monthly. Again, it's going to be claims data, so there's going to be a lag with it and things like that, which will be a measure, probably a proxy measure for how people are doing. And we do not have a plan to do a practice assessment throughout the year, but really this is brand new. This is certainly something we're in development, and I don't necessarily know if it's off the table. If we feel like it's something as far as like a mid-year check-in as things are as people have started implementing. So maybe we'll take that as a piece of feedback as we consider how this is actually operationalized next year.
No other questions, huh? Wow.
I'll take those good news.
Yeah.
We will post this and send out this link. And please reach out to our inbox for any further questions. We're really excited about this opportunity.
I think someone did put something in the chat box. I just caught a glimpse of something. So
I see that. So how many practices are in scope for this work? Kim, do you want to take that?
Again, we had about 50 applicants. We have to go through and review these particular entities to see what is, do they meet all the criteria? So it could be anywhere between 50 to about 10, maybe. But until we get that assessment done, we don't have quite all the numbers yet.
The other thing we'll add, we had 50 entities. We do believe at least one of those entities includes multiple practices. But it hopefully will give you a sense of the number. But I agree with Kim. I think we'll probably end up somewhere around that.
All right, one last call. Any other questions? Okay, so just next steps. Remember, the deadline is October 4th at 5 p.m. If you do think of any questions after this session here, you are free to send it to the equip@crisphealth.org because your participation is critical for our success. We will send out this slide deck to you so you have access to all the links. I'll make sure that gets sent out today for you. And thank you guys so much for your participation, and we really look forward to hearing from each of you. Okay. Bye, everyone.